Newborn baby, cyanosis, severe respiratory distress, born at like 38 weeks. Classic red flag for a congenital diaphragmatic hernia. It's a life-threatening condition that arises from a failure of the pleuroperitoneal membrane to close during fetal development. And so what results is the abdomen contents are going to herniate into the thoracic cavity, usually on the left side, right? And so you're going to be compressing the developing lungs and causing your pulmonary hypoplasia. And so you often see little loops, bowel loops in the chest and a mediastinal shift as well. Decreased breath sounds only on one side. Surfactant tissue, you'd think of like preemies, neural crest defects, different systems. And if we have a neonate, which we'll see in our question stem, you should think that the diaphragm's failed construction is going to be our real problem. So we have our newborn coming with cyanotic, becomes cyanotic after delivery. Examination shows decreased breath sounds on the left side, and we have the gas loops. Okay, what's the embryological defect? Is the failure of the pleuroperitoneal membranes to fuse. So yes, failure to close these folds that we talked about, where the abdominal contents are going to herniate into the thoracic cavity and compress the developing lungs. So that's going to be our condition. Here's some little histological sides that just popped up with a nice little chrome extension as well. Septum transversum failure, that's involved in your central tendon formation, but not going to be your posterior lateral diagram where this is actually going to occur. And if you guys have ever seen this on an exhibit, you'd see like there's a distinct right hemidiaphragm and then like a displaced cardiac silhouette. So it looks really, really interesting. There's like a gastric feeding tube that they'll usually pop in there, and you'll have a distinct right hemidiaphragm and then an indistinct left hemidiaphragm. So there's going to be like some herniations that you're going to be able to see if they give you something to look at. Surfactant deficiency that causes your hyaline membrane disease, mostly in preemies, not your neonates that are full term. Neural crest migration defect, that's, you'd think of your DeGeorge or your Hirschsprung, not going to be your congenital diaphragmatic hernias. And vitelline duct persistence, that's meekles diverticulum, not going to be pulmonary symptoms, or your bowel in the chest. And so that's why that's not the answer. So yeah, look out for the neonate, cyanosis, tachypnea, asymmetric breath sounds, that's huge, decreased, especially on the left side. Your scaphoid abdomen, that's going to be because you have abdominal contents in the chest cavity. And on x-ray, you'll see air-filled loops in the bowel, loops of bowel in the thorax. Also the mediastinal shift you should look out for, and then they'll usually put like an NG or like a feeding tube in his chest, and you'll see that as well. Okay, so it's definitely not a prenatal issue, and embryology is going to be your pleuroperitoneal membranes that are not going to be fusing. All right, that's all for this one. See you in the next video. Like and subscribe if it's helpful.